wanted to spend a few minutes looking at the various medical problems that affect children. I did include an audio for the section on cerebral palsy, emphasizing that it is a medical problem that affects children as well as adults. It is something that is acquired in your utero or sometimes up to a few months after birth. We're seeing more children with cerebral palsy due to the life expectancy of premature children has dramatically changed. Children are surviving now that are born weighing just a few pounds, so we're just seeing more incidents of cerebral palsy than we have 50, 100 years ago. The great thing is that today there is so much more education about how to better help children who have cerebral palsy thrive and become as independent as possible, as well as being mainstreamed in education and being quite successful, depending upon the severity of the cerebral palsy and what type of presentation results from the condition of cerebral palsy. Cerebral palsy is not progressive. It does not get worse. Certainly musculoskeletal problems from having cerebral palsy can worsen, but it is not a progressive neurological problem. So you'll see more children and adults with cerebral palsy than probably other medical problems just because of the higher incidence. I did want to spend a few minutes talking about, I think Duchenne's is covered quite well by the supplemental video. I did want to talk a little bit about Down syndrome. This is caused by a specific gene, and called trisomy 21 or trisomy syndrome. It is something or a health condition that is fairly common. I think the beautiful thing today is how children with Down syndrome are being integrated into school systems and are being challenged physically to thrive and to get stronger and to learn new skills, versus before, even when I was a child in the 70s, that's dating me of course, but the mainstreaming just started, and the life expectancy for a child with Down syndrome was pretty low, like around 21 years old, believe it or not. And now people with Down syndrome are living longer lifespans, so it's pretty cool. And depending upon the the care and certainly the support and other socio-environmental factors, looking at the ICF model, as well as exercise and physical activity, quality of life is greatly improved for individuals with Down syndrome. The next medical problem I wanted to look at is, I wanted to make sure you're familiar with this picture. This is of a spine, and if you look right at that is where the medical problem of spina bifida is present. Now what happens surgically, because it's a neural tube defect, is that surgically a neurosurgeon tries to close up where the problem is within the spinal cord. And we're seeing some people with spina bifida, individuals, live very high quality of life. It's one of those things, there's a spectrum, I would say. similar to Down syndrome and similar to cerebral palsy. There's quite a spectrum of presentations. I worked with adults with spina bifida because of the numerous surgeries that occurred with this one. He was a 30-year-old man when I worked with him, but because of the numerous surgeries he was just behind his peers, and so he was playing catch-up for most of his life, and didn't graduate with his classmates, and had to go to school a few extra years, and college was a struggle for him. But he is thriving and working and doing great. Did have to wear AFOs, result of spina bifida bracing when he was younger, but that's no longer a case for him. So there's a spectrum, and I think that's really important when you're looking at these health conditions. And I would just continue to, if you're going to have a special interest in a certain area, to continue to get educated on that specific area of practice, especially if you're going to work with pediatrics.